Hello and good morning, everyone. Happy New Year 2026. Good morning, Dr. Munné. How are you?
Good morning, Adrian. I'm great. Starting a new year, and I hope you guys had great holidays and ready to tackle this 2026 is going to be a fantastic year for all.
That is correct. Thank you so much for tuning in, guys. Don't forget to leave your comments below on all our social media, Instagram, Facebook, TikTok, YouTube. Please stay tuned for amazing topics for this all over the year 2026. And let's get right in, Dr. Monet.
Yes.
So today we are going to talk about, what is the worst thing that can happen this year regards to my dental health?
Mm, Good question. The worst thing that can happen, it would be that we lose a tooth. So, our teeth are very valuable, and I think that right now the problems that we deal in the dental office that have like the worst consequences is tooth loss. Why? Because once we lose a tooth, there's two options, right? Replacing it or not replacing it. And I see patients that they have multiple teeth that they have been lost and they have not been replaced. And that causes a lot of issues. Number one, there's a problem with the fact that your chewing functionality is not going to be the same. So you're going to favor one area versus another one because you have more teeth maybe on one side than another one. And then the area that you're using constantly is going to start having some issues. Then what's going to happen if you lose all your back teeth? Well, you're going to start using only your front teeth, and then that's going to push your front teeth forward. If there's gaps in your teeth, like you have a missing tooth, the upper tooth is going to come down. The other two teeth are going to move in. So there's a lot of movement in our teeth that they're going to want to take that space. So all the forces that we apply when we chew, when we bite, those of course they're pushing the other teeth, and if there's a space, so that space is going to be overtaken. So very common problems on patients that are losing teeth is that then all their bite gets all misaligned, and there's like very severe bite issues. So I think that losing a tooth is really the worst that can happen. And then, of course, the replacement also is probably more expensive, replacing a tooth, than any other treatment. So my recommendation is get to the dentist as soon as possible. Try to do all the preventive methods, and we're going to talk about a lot this year about prevention. But also, if you have an issue, do not delay. I think that procrastinating treatment is probably the beginning of losing your teeth. So do not procrastinate. If you have a problem, the sooner that you tackle it, the sooner that you treat it, the better. And so let's do it today. Let's not wait for tomorrow. To try to address it and treat it as soon as possible, and always try to prioritize saving your teeth. Definitely.
Yes, thank you so much, Dr. Monet. Please don't forget to leave your comments. They're very important for us as a feedback to follow up with you with more interesting and intriguing topics that are landing right on your alley. We want to follow up with you and actually answer the questions with the experience that Dr. Monet has on this field. Thank you so much, Dr. Monet. Would you like to add anything else about if you lose your tooth? What could happen, but what can they do to actually prevent losing a tooth, first of all?
Yeah. Well, we're going to talk, as I mentioned, more about prevention, but that's going to come about doing your cleanings and brushing at home, and
Yes.
maybe getting also to the dental office and having your regular maintenance cleanings. And that's going to depend a little bit in your situation. So some patients need to have regular dental cleanings every 6 months. Some patients need every four, some every three, every two, and every one.
Very
So
important to visit your dentist.
that has
Yes.
to be tailored to your needs, and that's something that your dentist and your periodontist will help you figure out what is the best interval. So every time you come, you're actually in health, and we don't need to start doing more treatment and more treatment. And then, of course, the day to day, right? Everything that you do at home. And if you lose a tooth, then which options do we have? Well, If you have missing teeth, then it's important to replace them. The best option is the dental implant, and the dental implant is, just to give you a little idea, the dental implant is going to be like a screw that goes implanted on the
Mhm.
tooth. If you have a dental implant, of course, the screw is only going to be on the bone, but then how we tie it up that into and become a tooth. So first of all, the implant will be exactly in the bone implanted, and then on top of it, we're going to screw a post. That's called a post or an abutment, and that's going to be screwed in, and is this metal part that goes right into the
Yes.
screwed into the internal part of the implant, and then that can have a crown placed on top. That's how from the implant that is implanted on the bone, and that's why it's called an implant, it becomes a tooth. Now, let's say that for some reason you cannot have an implant for ability, then your other option would be a bridge. The bridge is not a lot cheaper than the implant, because obviously you need to have the tooth removed anyway. So if you look only at the replacement, then it's not so much different to have a bridge, because the bridge you have to do three crowns. So what is a bridge? So you have a missing tooth, then we have to file the next two teeth. So we're going to file them down to make room for the crown, and then we will place a bridge. That bridge is actually like three crowns together, but you can have a bridge with four, five. So the longer the bridge is, the more expensive, because you have to pay for each crown individually. So a 3 unit bridge is going to be cheaper than a 4 unit bridge or a 5 unit bridge. The longer the bridges are, the more strain that they're going to put on the teeth that are holding that bridge. And that bridge is going to be cemented. So it's going to be permanent in a way. I mean, it's not, nothing is permanent, but it's going to be permanent in the sense that it's not going to be removed. It's not something that you take out to brush your teeth. So that will be in there. And it's important to have very good maintenance, as we were discussing, because the margins of this bridge, where the cement, that's usually where the decay begins.
Mm.
And then you could have like decay going into it, and then it just decays all these posts, and once the post is decayed, the bridge doesn't hold anymore. So there's advantages and disadvantages, but maybe that could be a good topic for
Yes,
next time to talk
definitely.
about what are the advantages of the implant and the disadvantages, and then the same thing for the bridge. So that might be a good follow-up topic.
Thank you so much, Dr. Munné. Please don't forget to tune in almost every Friday in the morning. We are here for you to answer all your questions. Don't forget to tune in and your social media posts. We actually have content every week: Instagram, Facebook, YouTube, TikTok. Stay tuned and see you next week.
Okay, let's do the other.